can be such a pain in the back. Ugh. Hi, I'm Ginger Bratzel from Mobile Marketing for Dentists and New Patient Attraction, and I'm going to get off the marketing and practice growth message, but I'm going to be conveying something that's very important to anyone who practices dentistry. And this is something that's going to affect you, any one of us at any time in our practice, and it's about protecting your back. And you might be in that situation already. I know I'm in that situation already. If you don't know my personal story, I practiced for many, many years in dentistry, and I also had a marketing business on the same time. And practicing in dentistry has gotten so painful for me that I cannot even continue to do that. So now I'm dedicating all my time to marketing. And I have back issues, I have arthritis issues and spinal stenosis, and it just got very, very painful and difficult. So I don't take my back for granted. I have permanent damage, and it's very, very, it hurts to do what I love to do. But I go through, and my back is still a very important part of mine, and I just hope that everyone is proactive. That's my first step, is be proactive about your back. Don't take it for granted. We were taught how to do in dental school, but even then we get into sloppy habits. If you need a refresher on ergonomics and where you need to be on your positioning, do that. If you need to invest in new chairs, if you need a new dental chair for your patients, you need to do what you need to do, because like I said, you only have one back, and once it's gone, you don't get it back. So be proactive and take action. Number 2, once I had damage, and what has worked very, very effectively for me is I have a physical therapy team. I've gone through back school, I do back training, stretching, exercises, yoga, and I have to do it now every day. I don't get to take a day off. And that's really frustrating, even with a very active life, to be able to have to take that time. And I pay the price dearly if I don't do it. I have to work on getting my mobility back each and every day. And so it's so frustrating, and I hope that nobody gets in this situation that I'm in. But don't take it for granted, and if you're there, take the time and invest, because like I said, I don't want to ever lose what I worked so hard to get back, and being able to have my mobility back. Still have to live with the pain, but I do have the mobility back. So physical therapy is part of it. Number 3, build a core. We all love our sweets. We love getting a little softer around the edges, but if you have a strong gut, you have a strong back. And so that is so important to my training now. It's working on that, so make sure you don't neglect your core. We all say, oh, I need to lose a few pounds. I'm getting a little soft on the middle. Make it a priority. Make it happen. It just has to do. Number 4, stay active. Take the time for exercise. Again, we get a little soft in the middle sometimes. You don't get that back once that damage to your back occurs. So make sure you're active. You have a physical lifestyle, a regular exercise regimen. I don't get away with not skipping a day anymore, and it really frustrates me. But again, I want to save you the hassle I'm going through. Number 5, this is really important to me. Build your back team. These are physical therapists, physicians. If acupuncture works for you, it didn't work for me necessarily. Yoga works for me. Massage is a wonderful thing. Heat, all these things. I have to have a team to make sure I'm taking care of myself and my back. So make sure they're working for you. I fired a physician this week because they weren't on my back team. They didn't care. They were worried about the system and running in and out. And if they're not committed to giving you the best care you can, go find somebody else. I don't care if they're the best in the business. That's what they kept telling me. They're the best doctor they are. It doesn't matter. They weren't dedicated to my health, and they can be the best for somebody else. So let them go. Cut them loose, and make sure you have people who are working for you on your back team. Number 6. Drugs are not the answer. I wish they were. I wish there was a magic bullet. It gets you through some of the rough spot, but you need to build on these other physical activities and preventive measures, and make sure you're not in the drug pool and the pill popping thing. And then number 7, I want you to have a very important thing on your back team, is make sure you have disability insurance in place. You'll invest in health insurance, you'll have life insurance, you have business insurance, but a lot of people miss the disability. And when I got hurt, I had disability insurance. Never thought about it until I needed it. And I happened to have it. Got it right out of dental school, was updating on a regular basis, even forgot that I have it when I had to leave practice until the bill came. I was like, oh my gosh, I forgot I have disability insurance. And if I didn't have that plan in place, I would be in a different situation. You also need to have a resource team. If something happened to you, do you have a colleague and you have agreement with them that they would step in your office and work a day or two to help you with your patients? Do you have that resource? You know, when I had to leave practice and trying to transition and sell the practice and transfer patients and do all that stuff, it is so frustrating, and you're dealing with your health, and it just drains with you. So if you have an action plan in place first, your disability, make sure it's up to par, then it'll make it a lot easier, and hopefully you never have to use any of it. That's the safest insurance. If it's in place, you don't have to have it, and if you do, it's there. So I hope you found this useful. It's coming from the heart. You know, I want to save you any hassle from what I went through to make sure you don't have to go through. So I know how much you love to practice. Let's make sure you keep doing it because patients need you. I'm Ginger Bratzel from Mobile Marketing for Dentists, and if you found this useful, please share it. And if you ever have any questions, when you want to be featured on, have a question for a future episode, I would love to have you featured. Just put it on, email us at results@gingerbratzel.com, and we'll try to get it on. Thank you, and bye-bye.